Having safe, secure housing is so important for your health. As a social landlord, we are one of the largest housing providers in the area with over 32,000 properties, and we work really closely with the NHS as part of the Housing Health and Social Care Partnership to address the effects that housing has as a determinant of health.
CareLink is a 24-hour, 365-day-a-year monitoring service for the vulnerable. We're there to be that person that they can contact in an emergency. People press the pendant. If they've fallen or they don't respond, I would go out with my special lifting equipment and get them up off the floor.
I find it very good, honestly I do. You've got peace of mind. That peace of mind is, well, it's worth the weight in gold basically.
Last year, just short of 3,000 people we picked up off the floor, so that frees up the ambulance service to do their job, to go to people with more urgent requirements.
Our independent living teams manage schemes across the district. The armchair exercises is great fun. It's low impact, but it means that people can go and get a little bit of exercise, but really that social interaction that they get with it that's so important and can really help with their health. Feeling comfortable where you live is so important. You want to see your home as your safe place, and it's really important that we support our communities to feel that in their homes. So we have a specialised learning disabilities and autism housing coordinator who can support people who are not living in the right setting.
My role is to support and source properties for people with a diagnosis for learning disability or autism. It could be that someone's in a supported living but the environment's not good for them, and it can be detrimental to their mental health, and it can be a struggle.
Tom's had learning difficulties since he was born. We couldn't have Tom at our house because my husband's got cancer and my daughter lives with us. I didn't realise how little he couldn't cope. The bills were coming in, letters were coming in, they weren't answering and we were getting into debt. They were very vulnerable and he just didn't really know where to go, did you? That's sort of when the housing officer stepped in and got him an adult social worker and put us in touch with Nicola.
When Tom came to me, he was in quite significant debt because he'd not been able to manage the tenancy. I managed to be able to speak with the debt team to help with a grant and to be able to support him and get him some short-term accommodation within an independent living scheme while I was working with a social worker to find hopefully some supported living.
The support I've received from the learning disability housing officer, I wouldn't have got through it without her, I really wouldn't.
It's been nice, it's reassuring having someone ringing, see how you are and stuff.
We've been down to darkest place in his life, I think, haven't we? But now we're getting back up there.
Housing is just one building block of someone's life. It's really important that we work with other people within the NHS to make sure that that one piece fits with all the rest to make sure that people can stay healthy.